Welcome to Board Certified, expert interview episodes about medical licensing exams and healthcare careers. I'm Cassandra with Achievable, and we offer affordable, adaptive online prep courses for the USMLE Step 1, MCAT, PTCE, MPTE, CSCS, and others. Each course contains everything you need to succeed, including comprehensive study guides, video lessons, thousands of practice questions powered by our memory-enhancing algorithm, and full-length practice exams. You can try any course for free at achievable.me, and if you like it, use the code podcast to save 10%. Now, let's get started. Today we have Dhruv Shah with us, and I would love if you could introduce yourself.
Yeah, thanks for having me, Cassandra. Yeah, my name is Dhruv Shaw. I'm a licensed physical therapist here in Glendale, Arizona. I've been practicing for a year and a half, and prior to, I was working as a licensed physical therapist assistant back in Indiana.
Amazing. So, yeah, thank you for being here. And today we're talking about the overview, the ins and outs of physical therapy. So, to get started, would you mind walking us through the different career paths within this industry and with that kind of the growth opportunities with each workload, work-life balance, and things like that?
Yeah, of course. So, with physical therapy, so initially when I had first started, it was me just trying to get my foot into the door, working as a clinician, trying to work with patients and getting to know people a bit better, and knowing that it was a career where when I started to get into the clinics themselves, I was able to feel and act the way I like to feel and act, and it didn't cause an issue. And so I was able to be who I was as a person. Now, when you're trying to get into the field, at first you're just trying to go in as a clinician. You learn about the anatomy, biomechanics, physics, whatever courses that you learn in your undergrad. And I know for me, I took a lot of classes dealing with healthcare, and that opened my eyes to a whole different world with physical therapy because it's not just you go into your clinic, whatever setting that you're working in, you clock in, you prep for your patients, you treat them, do the documentation, then you clock out and go home. Everything that we do deals with all aspects of life. And by that, I mean you deal with politics, legislation, you deal with administrative behaviors, you deal with different personalities. And so once you get into the field and you actually learn about how physical therapy actually works, that gives you an option to try to pursue other areas. Now, it's not just in a clinic that you can do physical therapy. You have physical therapy in classrooms. You have physical therapy in the sports world. You have physical therapy in the military. And growing up, I still am very big sports fan. I love watching football, basketball, baseball. If there's a sport on TV, I may try to watch it to see is this something that I would enjoy. And you start to learn about how every single industry works differently with physical therapy. And I wanted to maybe work on a sports team when I was first getting into the field. And then as I did more research and I learned about it, that kind of drew me away from it because it wasn't necessarily something that I would want to do. Because for me as a PT, I like to have a lot of control with my patients and what I do with my treatments and plans of care outside of what the referring provider would want. With sports, from what I've learned at least, you're working under an athletic trainer. And this is not me trying to put any hate on athletic trainers. I love the athletic trainers that I've worked with in the past. I just don't necessarily want having anybody above me trying to dictate the plan of care. And so for that, it drew me away from working in sports. And also the hours are very crazy because it's not just you come in at 8 o'clock and you see your 8 o'clock and then your 9 o'clock walks in and you see them. You're working on whoever, whenever, and that's just how it is. You basically work with what the organization wants. And for some people, that's very fun working with professional athletes, being able to travel is just a lot of on the road stuff. And that wasn't something that was necessarily for me. So I did not want to go in that direction. Now, I am trying to work on becoming a PT in the military. I'm currently in the process of that. And so that's a story in itself. But I did some job shadowing at some military bases here in Arizona once I was able to get in touch with some bases to get my foot in the door and learning about how the military operates, how physical therapy works, and how you would have to balance yourself. That gave me a good idea on what to expect whenever I'm working in, if I'm able to work in the military. And it gave me an idea of if I get tired of working an outpatient, what other options do I have? Because even in the military, from what I learned, there's a lot of opportunity to grow there, whether it's in the ranks, getting further education, whatever the case is. Obviously, I'm not in the military, so there's not much more I can give on that. But from what it sounded like, once you get in, there are so many different possibilities about what you can do. And then even in physical therapy itself, like right now, I'm preparing for the orthopedic clinical specialist exam to become an orthopedist specialist. So there's a lot of certification that you can get. You can get a neuro certification, pelvic floor, you can get sports medicine, orthopedics that I'm going for geriatrics. They have a lot of options if you're wanting to specialize and do that. So that's also very good. The one that I'm the most passionate for is the legislative and political side. I'm a very big political junkie. I'm always following on with current events and what different administrations, whether it's local, state, or federal, are doing with making changes to how reimbursement rates work, how lobbying works. And so that is something that I see myself doing as like my fallback once I get tired of treating as a clinician. And if I want to get into marketing as a clinic director, then I can earn management as a clinic director. I could do that. But my ultimate fallback plan is probably working in healthcare legislation and getting into the political side of things, whether it's working with a local APTA chapter, whether it's working on a campaign, or trying to run for an office myself. So that's just 3 or 4 of the ones that you can go for. There's so many other avenues. You really can't find something that you don't like once you get into the field. So it's really nice.
I guess my question next is, can you walk us through a day in the life, a day-to-day overview of a physical therapist? And obviously, that's going to vary greatly depending on your role. Something I think to touch on is managing multiple patients and having time management skills and any other responsibilities beyond the hands-on treatment. Can you just walk us through the day-to-day?
Ah, yes, the meat of it all. Love it. Yeah, so this is the portion of the career where when you're first getting into physical therapy, you have a general idea from the shadowing about everything that you're going to be doing when you get into your clinical rotations, what you're going to be doing. But once you're actually in the clinic and you're in charge of your own decisions on what the patients do, because like when you're a student and or when you're shadowing and you're not even a student, you're just watching. That's it. When you're a PT student or PTA student in your rotations, you don't get to call the shots. The whoever your clinic instructor is, your supervisor, they call the shots. When you get into being a licensed clinician, those decisions fall onto you yourself as a clinician. Sometimes that's scary because you're like, you need an adult, and it turns out you are the adult and you don't know what to do. And then other times it feels very comforting to know that you are in charge of your own schedule for the most part. For nursing homes and hospitals, with my time working in those, it's like the same thing almost, where you go into the patient's room, you ask, hey, I'm so and so, I'm from PT, will we ready to get out today? Sometimes they're like, yeah, let's get going, and they'll be like, get out. And so you try your best. If they tell you to get out, you don't want to push too much because, it's one day of treatment that you might not do. You don't want to get them grouchy and then they start saying no to other people or start saying no consistently on other days. So, big one is picking and choosing your battles. What is it that you're willing to fight, and what is it that you're willing to just be like, you know what, forget it? Because there's some days where we'll have a patient call in and they're like, oh, that last session, it really killed me. I can barely move my legs, everything hurts. And you can take one of two options. You can tell them, hey, you know what, we did too much, that's okay, take today off, and then we'll see you next time. You can also say, that's normal, it's expected. having that much soreness afterwards, not necessarily the greatest thing, but what we can do is this. You're going to be in pain whether you come in or not. So you can either choose to just take the day off, and that's okay if you want to do that. Nothing wrong with that. We can always see you next time. Or you come in, we see what's going on, what exercises really got you to be less functional, and then we can take a more soft tissue approach to just calm the muscles down and get you feeling a little bit better. That way, up until now in your next session, you can be a bit more functional and continue with your day-to-day activities. Now, if this is like the beginning of the week or just a random day, yeah, I'd definitely be going for that. If this is the end of the day or it's the holidays and I'm already mentally feeling burnt out, I'm not going to try to fight it. I'm just going to be like, you know what? Take some pain medication if you need to, get some rest, and then we'll see you after the holidays. Because you want to try to help the patient whenever you can, but you don't want to do that at the cost of your own well-being. And the thing I always tell new grads is, you're flying on an airline and they tell you about when the oxygen masks drop, if you're still paying attention at that point, they always say, help yourself before you can help whoever's sitting next to you. If you can't take care of yourself, you can't expect yourself to properly take care of somebody else. Even though this is a patient care field, you are still a patient at the end of the day. We have our own aches and pains whenever we get off of work. Some days I go in there and my patient's having better symptoms than I do. And I'm like, this is not right. I should be taking care of myself. But you have to take care of yourself because if you're not feeling it and you tell them just come in and then you work on them, you don't want to have some lapse in judgment and overlook something that could have been important that they tell you, and then it turns into something worse. You can always tell them to contact their PCP to see if they can get in, whatever the case is. But sometimes you just cannot see a patient, and that's okay. You don't want to just save face by trying to get your numbers up and seeing the patient. You yourself, as a person, are just as important as the patients that you are seeing. And most of the times, you're in a good mental capacity and physical capacity to be able to see somebody, but sometimes it's just not going to work out. And that's also where managing your own schedule plays a major factor. And for me, working an outpatient, I see a lot of patients depending on the day. And I enjoy that. I don't see anything wrong with that because it's something that I'm able to manage. If you're someone that can't manage, that's okay. You do what you can and how you can. Because even if I'm seeing 18 patients and you're seeing 11 patients, if you're doing a damn good job with those 11 patients, that's great. Like you'd rather see 18 really good patients than see or 11 patients than seeing 18 patients, but then half of them you weren't really even talking to or you were neglecting because someone else needed a bit more attention and you just neglected this patient and they're just wondering what's going on. Like, why am I not getting the attention that I deserve to have being a patient? And so if you can make it work however you can to put the patient first and yourself as well. If you're not able to do that, then it's going to backfire on you and it's going to make things a little bit worse. And you don't want to have that. People have a hard cap of a certain number of patients during an 8 or 10 hour shift. And there's nothing wrong with that. You always want to push back and make sure that you yourself are comfortable, especially if you're overseeing and taking care of that many people on a day-to-day basis. With that being said, when you're coming in for your shift, when I was a PTA, I would come in like an hour early and I would prep for all my patients in the morning and just see what exercises they're doing, what do they need to do, what do I want to do with them, and just plan my attack. I don't do that as much anymore. Not because I don't think I need to, but most of the patients that I see are the ones that I evaluated. I know their stuff front, back, left, right, better than them sometimes. And so I don't necessarily need to come in as much to prep beforehand. And the other thing is, you don't know how they're going to present when they come in. So you don't know what they're doing between their last session and their current session. They could have done nothing and been okay. They could have tried to walk and they sprained their ankle or something like that. You can plan all you want. You have to be ready to audible and make changes on the fly to your plan of care. There's times where a patient comes in and they're having the worst pain of their lives, and I wanted to progress them on their core exercises. Now we're doing what we did during the first session, working on some soft tissue, doing a lot more stretches, doing some low level strengthening exercises. and then they feel great at the end of it. So, mission accomplished. You did what your job is. Your job isn't always to try to make them progress or try to challenge them. It's addressing whatever issues they come in during that day. And you have to be able to plan for that on the fly, not beforehand. So, it's always good to prep for your patients beforehand, don't get me wrong, but don't expect it to always play out the way you want it to play out. And then, oh, it's gonna be a lot of tangents today. This is good. Whenever you're trying to plan your day out, that not even your day, your week out too, because with me being a evaluating therapist, I'm also scheduling out these patients. So if I know that this is just some very high functioning patient that can really do a lot of the stuff on their own, I can really put them anywhere because they just might need some direction and guidance on their cueing and form, and maybe the rehab aides who are also very skilled, they can also work with that patient. But if you have someone that's very, very needy, not just like personality wise, but also they require a lot of hands-on therapy. They might have some neuro problem, they might have Parkinson's, or they might come in and they have cerebral palsy. You need to spend time with them. You cannot be doubling yourself with them and then having a 80-year-old who's a high fall risk. That's not going to be safe for either party or anybody. So you have to know who your patients are and what their level of neediness is, and then you plan based upon that. So you're not doubling them with somebody in a wheelchair that needs hands-on for most of the session, or someone that has a high anxiety and they need a therapist there because everything else is very overstimulating and that freaks them out. So knowing the personalities that you're dealing with, knowing their level of need, and knowing what their condition is that they're coming in with, those are all things that factor into how you're going to schedule them to make sure that if you're seeing them, that they're in good hands, or if they're a higher level patient that doesn't necessarily need to see you, you can use your rehab aides and your OSS, your rehab aides to take over if you need to spend a little bit more time with the patient. It's not just I go in and I see the patient. It's making sure that I'm set up for success, and then making sure that my physical therapist assistants who are also seeing patients are not getting screwed over in the meantime. Because our PTAs are very important, and we want to make sure that they're very busy. That way, their hours don't get cut, and they can also provide the help that patients need and that therapists need. If you're putting patients willy-nilly on them, you're not setting them up for success. You're potentially making their life more miserable, and that's not going to play well in the long run because now you're potentially burning them out in the process. The easier you can make other people's lives, the easier you can make your own life. Because when it comes down to authorization, progressing a patient's plan of care, whatever it is, that's going to be on the evaluating therapist. So if you can set them up for success right now, you're setting up yourself for more success and less mental tasking activities later on when it comes to reevaluating them, trying to plan their discharge, whatever it is. And then there's insurance. Insurance is a pain. No one likes insurance. I don't even think insurance people like insurance. But that's another thing that you have to come in and deal with as well because some patients, their insurances, they're like, here's a post-op patient, you got 6 visits, and you're like, what am I supposed to do with this? I'm not a wizard. I'm not going to just bitty boppity boop and you're fixed. No. That'd be nice, but that's not how the body works, unfortunately. And so you want to make sure that if a patient's coming in, how many more authorized visits do they have? Do you need to fill out an auth form? Do you need to send a progress note to somebody? Or maybe they're coming towards the end of their plan of care, so now you have to schedule them out. Now you have to look at the schedule. Where can I fit you? Because now again, the schedule is going to be full somewhere, and people want certain spots because of how their work schedule works. So they can only come in after 4 o'clock. I'm the only clinician that works after 4 o'clock, and I only have one rehab aide to help me, and I have this many people already on my schedule, so I can't just mess up their physical therapy because I'm trying to squeeze you in to try to get my numbers up. When you're an evaluating therapist, that is where your clinical judgment and decision-making skills needs to come into play. If you cannot see that patient because it's going to overload you and affect the other patients, you cannot or do not schedule them. Because then it's a matter of you lose that visit, but then you also might affect the visits of the other people, and that might leave a bad taste in their mouth. Because you hear it all the time where yeah, I went to PT and I was on the bike for 10 minutes and then the rehab aide took me through this and I never saw my physical therapist. That's not always a good look. That makes the patient feel like the therapist doesn't necessarily care about them. And that's going to leave a bad taste on the company that you're working for. So now you're losing that visit. And then if someone else, because people talk about their therapy, how it goes. I had family members like, yeah, I had my knee replaced and the doctor did this and the physical therapist did this and this. They talk about it. People will be like, oh, yeah, I'm getting my knee replaced. Who'd you go to? Where'd you go to physical therapy? People talk. It's free marketing, but people talk. It can be good for you or it can backfire on you. If you leave a patient with a bad experience, they're going to tell people about it. Hey, I went here, it was not great. I wouldn't really recommend going there. Turning a patient away or not scheduling them isn't a bad thing on your end if it's going to screw you over in the long run. It's okay to take a small hit for a long-term gain. You keep 10 patients happy because you were attentive to them, you gave them good direction, you cared for them, they're gonna tell their friends, they're gonna recommend them to go to you, and you're gonna have more patients. And then if you explain to the patient that, hey, I want to get you in and get you feeling better, but if I schedule you at this time or if I have you here, I'm not going to be able to spend as much time with you as I want to, and you might be better served going elsewhere. I might have lost a visit, but I it's the same thing that you would want to do that you would I would want my family members to experience. Someone that's honest with them and turning them away, not because they don't want to be seen, but because you understand that you are not going to be able to give them the care that you need to and that they deserve. And I feel like that goes a long way of at least being honest and saying that, hey, this is my limitation. I don't want you to suffer as a result of it. So I don't want to have you come here or at least see me. You'd be better off seeing somebody else, and at least they know that we're not just trying to get them for their money. We care about them even if they are not with us, because at the end of the day, they're a human being who deserves to be treated as a human being and to be respected as a human being. And so I think that interpersonal connection when you're trying to manage your caseload and interact with patients is very important.
Yeah, that was an incredible overview. So thank you for doing the deep dive on that. I think that's super helpful. And you talked about the skills needed. Like you need to know how to strategize. You need to be a problem solver. Communication is huge. The adaptability, and then of course the technical skills that come with your certification and your licensing and just knowing and having the confidence that you know what's best for a patient. So the next question I have is talking about AI and how that's been introduced into the field and how it's implemented and what you think the benefits are, maybe the cons are, and walk us through maybe how you experience it.
I'm not a big AI user myself unless I'm looking something up on Google and AI just happens to answer it for me. But I know a lot of people do rely on AI, and we've had our Google doctors that come into the clinic and, oh yeah, I Googled this and I Googled that, and this is what I decided to do. Honestly, not the worst type of people I've ever dealt with. And those are, there's a pro and a con to it. The con is pretending like they know more than someone that has a degree in this. But the pro is that this is someone who truly cares and is aware of their own body. Whenever I would listen to some type of leadership advice, they're always talking about you should not be the people working under you should not be working harder than you. Whoever's the CEO, they need to be the hardest working person in that company. And every person is the CEO of their own body. I cannot be caring more about your health than you are. You are your own person. I have myself and however many patients on my caseload that I have to worry about. So if you're not caring about your health, I cannot help you because I can give you the tools, but if you're not doing the stuff that you need to do, you're not going to go anywhere with it. My patients that are honorary Google doctorates, they might be a slight pain in the rear, but at least I know that they care and that they want to get their health figured out. I have patients, they sit down and they pull out this laundry list of medications, diagnoses, doctor's appointments that they have. And at first, yeah, they might be a little bit crazy, but they're also very organized. They care about what their body's going through. They want to be functional and they're irritated that something might not be going the way that they want it to go. And honestly, I respect that.
a heck of a lot because it shows me that this is someone that they're coming to me and they're gonna want to listen to what I have to say. And at the end of the day, if they don't like it and they want to go somewhere else, I implore them to do that option as well. Find the best provider for you. If it's not me, that's okay. I'm going to be the best provider for somebody, and I'm not going to be the best provider for somebody. And that's where you have to shop around and see what therapist do you vibe with, what therapist is actually listening to you, and what therapist shows that they also care the same way that you care about what you're doing. Now, when it comes to the AI aspect, I haven't dealt with anybody that does this, but I know I'm sure there's some people that probably chat GPT their way through, oh, I have hip pain, what do I do? And then AI will be, oh, you should do this exercise, you should do that exercise. And if you're able to fix yourself doing that, more power to you. Please do that. Take control of your own health and do that. That's not going to bother me because you're at least you're disciplined enough to research what you need to do and then get it done. And if you're able to get it done on your own, it probably wasn't too horrendous anyway. So good job for figuring out your minor health ailment. Props to you. I allow that a lot. Now, when it comes to actually taking over physical therapy, I don't necessarily see that as a big issue because you can have patients that fix themselves with exercises, but that education is very important to get in person from a clinician. Because AI might not, you could probably tell ChatGPT, hey, explain this to me like I'm five, and they can maybe help you out and get that done for you. But there's only so much AI can do for you as a person, especially if you don't have that latter half of what physical therapy is. It's not just you come in and you do your exercises, it's you talk to your provider, you talk to them about what's going on with you mentally, physically, emotionally. Pain is not pain. Pain is just your body telling you something's wrong. It could be neck pain, that's because you're stressed a lot, or you're going through some traumatic event and you're all tense and now you have headaches because your neck hurts. It's not that your traps are tight or this, it's you haven't fully processed what you're going through. And sometimes I'm doing an evaluation with a patient, and the first 20 minutes of it is just them, word vomiting everything that's going on in their life, and basically me being not a physical therapist, but their counselor. And so you can't just AI your way out of that. You have to be talking to somebody. Now, could there be more people that get better because they AI'd their way through physical therapy? Then, yeah, that's fine. It is what it is, but it's not going to be an industry that's going to be taken over and replaced by a machine that's a robot that has no emotions. And that's going to be like, oh, go get some sunlight and smile more. No, that's not going to cure your depression. Talking about it, getting help, and getting back into the activities that you like to do are going to help with what you're going through. Obviously, it's not a cure-all because I'm not a licensed mental health counselor. I'm a physical therapist, so I can only speak so much on that part. But physical therapy isn't just exercises. It's managing your patient's emotions, how they're feeling, what they're thinking, getting them into a more positive mindset. Sometimes you are a motivational speaker, and there's too many aspects of physical therapy for AI to be able to take over. They might help you with the most basic exercises, but long-term wise, it's a person to person job. And I don't see that changing in the long term.
Yeah, that makes a lot of sense. And I think that's just great advice. You'll never be able to replace an actual human in a lot of these fields. Is it a great asset to have? Sure. It helps, but it's not a replacement. So I guess then, is there anything that we missed that you want to make sure we address before we wrap up?
I don't think we missed anything necessarily, but I do want to drive the point of you are be in control of your own life, whether it's your health and trying to figure that out and standing up for yourself. Fight back with me about what's going on. That's okay. Like, I want you to get pissed off about why you're hurt. You should be pissed off that you're hurt. Nobody wants to be hurt. So stand up for yourself. Ask those questions. If you have to be a thorn in your provider's side, be a thorn in your provider's side. I don't like it, but at least I know you care, and that means more to me than you just doing what I say. This is not me telling you what to do and you do it. This is you in the driver's seat and me in the passenger seat giving you directions. And if you miss a turn, I'll recalculate and tell you how you need to get back to where you need to be. but fight back as a patient, speak up for yourself, don't be afraid. If your provider gets mad at you for that, you're seeing the wrong provider. Your provider should not be mad at you for being passionate about your own health and healthcare. You should be really being a pain in somebody's butt when it comes to you being a pain. And if you're a clinician, same thing, stand up for yourself. If you cannot see a patient, don't try to see a patient. Accept your limitations and acknowledge it. It doesn't make you less, it makes you more respected, at least in my case. I've told patients I don't know what's going on with them, but I'll try to figure it out, and they care more about that than if I actually get their pain situated. I might not be able to figure things out for them, but I'll figure out a way for them to figure it out. So it's kind of like a both sides thing. Both sides need to do what's best for them and set boundaries. Because if you let those boundaries get pushed, you will get taken advantage of, unfortunately. So stick up for yourself and don't be afraid to.
Yeah, 100%. Great advice. Thank you so much. This has been board certified, hosted by Cassandra from Achievable with Dhruv Shah. And Achievable has great online courses for the USMLE Step 1, MCAT, PTCE, MPTE, CSCS, and others. And you can try them out for free at achievable.me.